All right.
So I'm Jonathan Dean. I'm the STI tester with Hudson Valley Community Services, and I'm
Andy Reid, STI tester from Hudson Valley Community Services also.
Awesome.
Why are we here, Jonathan?
So we're here to talk about STIs and how to stay protected, as well as some services that HVCS still offers.
So in terms of restating, and reiterating STI symptoms and, signs of STIs, it's still important for people watching this video to realise that we can still contract and pass on, STIs, HIV, Hep C by doing things like, having unsafe sex, sharing syringes, stuff like that. So these are things that we need to still make sure that we don't do it in these challenging times. Is there any ways, for example, Jonathan, that you think that we can still practice safe injection practices at this time?
Ways to practice safer injections. So you're asking me as to whether we provide a way to offer safer injections?
Yes. Are there still any, HVCS services open, able to provide services for people who use syringes?
Yes. So the SEPVEN is currently still running. It's a Syringe Exchange program, and they are still available to give clients clean needles or anything else that you could possibly need for safer injections.
Now, while you're talking about that, Jonathan, I've got some times and stuff like that, and services that the Syringe Exchange, or the SEPVEN as it's commonly known, does operate, and the services they provide. So in Kingston, they are available on Tuesdays from 1 until 3 p.m. In Poughkeepsie, it's a Thursday, usual time 10:30 till 3:30. Monticello, Thursdays, 11 a.m. until 12 noon. And in Newburgh, it's available Tuesday, 10 until 3:30. And it's at the usual locations that people would go and visit them. So the services that they offer would be, the usual syringe exchange. They also provide Narcan, ESAP vouchers, potentially referrals if people need referrals to places like rehab centres, medical facilities, counsellors. The Syringe Exchange staff will work with people in order to find somewhere that's suitable and is open and is taking referrals. They also, incidentally, offer fentanyl test strips. Now, the van staff are trying to protect themselves from the COVID virus naturally. And at this point in time, they are speaking to people while they stand outside the van and, keep a safe distance and provide the services they need through the window of the vans. And I hope that is satisfactory for each client. Also, Spring Valley, the facility in Spring Valley is open for special arrangements. And what special arrangements means is delivery of the aforementioned things that I talked about, the syringes, Narcan, fentanyl strips and stuff like that. A telephone number for people to contact anybody from the Syringe Exchange program. Most probably, if you call this number, you'll speak to Frank Barone, wonderful colleague of ours and very knowledgeable about the Syringe Exchange program. His telephone number is 845-476-2190. I'll repeat that, 845-476-2190. So that's important. There are places like Hudson River Healthcare and Cornerstone offering some services but they are impaired services because of the COVID-19. But yes, they are available. Now, going back to STIs, when we talk about STIs, what kind of symptoms are we talking about, Jonathan?
So about STIs, symptoms to look out for would be discharge, any type of rash, itching, flu-like symptoms is possible. So if you notice anything like this, it could be a symptom of an STI. Now, I always say that the most important thing you can do is get yourself tested, because one symptom isn't for one infection.
Right.
There are many different infections that can cause a similar symptom. So the only way you can know for sure if you have an STI is by getting tested.
And Jonathan, what's the most popular, or sorry, the most frequent symptom of an STI?
The most frequent symptom is no symptoms at all.
Yeah, so
which is scary.
If you're sitting in a house and you think, I'll be okay, it could be that you don't have any symptoms. So it's important for people to realise that and to be very careful. It's not just because people can contract and spread STIs through unsafe sex practices, but that that they may not know that they will have any, and also, especially at this time with the COVID-19 pandemic, it's important to keep ourselves and other people safe.
Exactly.
Now, one thing I wanted to mention before we round this up, because so many services are, curtailed at the moment, it's important to mention that it's not quite as easy as it was at the beginning of this pandemic to access PEP, post-exposure prophylaxis. So it's important that if we feel that, there could be a possibility that we become exposed to the HIV virus, that we are aware of that we may not be able to facilitate getting PEP, post-exposure prophylaxis.
And if you do feel that way, I believe it is important to take action as soon as possible, because it's just like you said, we don't know how easy it is to get access. So the quicker you take action, the more likely you can get PEP, for example, in the time frame that you need to get it, since you have to start taking.
Okay, wonderful. So everybody, I hope you can stay safe. I hope this video provides some information that will help you stay safe, and it will give you continued reassurance as we go through. Everybody, please stay safe, look after each other, look after yourself. Thanks.
Stay safe, everybody.